I'm Dr. Beth Molleson.
And I'm Dr. Alyssa Watson.
And thank you all for joining us here in the Veterinary Breakroom, where we have short conversations about relevant topics in veterinary medicine. And today, I like to think of it as a special episode, Alyssa, because it's just advice from two middle-aged gals here, just giving advice to, I don't want to say new grads necessarily, but young vets starting off earlier in their career. And we figured what better time than the end of the year to maybe do a little bit of a roundup and think about what sort of advice we would have wanted or can offer, again, to people who are starting off in their career. So, Alyssa, I will let you start. I think we're each going to maybe share 5 of our top 5 suggestions or recommendations or pieces of advice. So I want to hear what your first one is.
Yeah, absolutely. So my first piece of advice, and there might notice a theme throughout the episodes of these are things that sometimes I wish I would have done, or I wish somebody would have said to me early on. But my piece of advice is to try everything, even if it was something that you weren't exposed to, significantly during your years in vet school, whether that be ultrasound or something. And although I'm sure I'm dating myself there because we were not exposed to ultrasound at all when I was in school, although I'm sure, everybody is now that is coming out of practice. But also seek out, mentors in your community and other veterinarians that have those interests if your particular practice doesn't provide that for you. So one of the lessons, that I took away very, very early on in my career, I worked with a fellow of dentistry. And so he wasn't boarded, but he had a fellowship and he was one of the only ones in the area. And because of that, he really took all of the dentistry cases. Obviously, it was his passion and something. But I wish that I had been more empowered to ask to learn because I didn't end up staying at that practice. And once, then I was out for several years and I had not done these things. I hadn't even taken out deciduous teeth, because if I had a spay or a neuter that had deciduous teeth, he would come do that part of the procedure, while I took care of the gonadectomy, the routine castration or whatever, because, he felt that was his role in the practice, which is fine. But I wish that I had gotten more experience with that. And it's something that it's had a lasting impact on my career, where I am not super comfortable with tooth extractions. And so I wish that I had been more aggressive with that earlier on in my career, because the longer you're out, I feel like the harder it is to go back and learn new things.
I think that's a good point.
Do you feel that way?
Oh, yes, absolutely. I think, I think that is good advice. And I would add to it now, earlier in your career is the best time to try new things and the best time to kind of admit that you don't know everything and ask for help, which actually segues into my first piece of advice, which is use your resources. And by that, I mean all sorts of things. I mean, of course, your colleagues, if you're fortunate enough to work in a multi-doctor practice, your technicians or assistants who really do accumulate a ton of knowledge as they themselves build their careers. And then being a part of clinicians brief, and now working, of course, we're essentially an educational company. And I feel like I get to see so many aspects of veterinary medicine that I'm just too busy when I'm in the clinic to even appreciate. So like the number of resources that are online. So shameless plug for Plums Pro, which Plums, as you may or may not know, is associated with Clinicians Brief with the same parent company, but they have an amazing app that is basically your best friend in practice. Like you can look up anything. You can look, of course, all of your drugs, as everyone's familiar with Plums, but also can guide you on treatment protocols for different diseases. But things like The Companion Animal Parasite Council has so many resources. All of your pharmaceutical companies have web pages with tons of information about all of the drugs that you're using. Same with your nutritional companies. They all have reps that can be on the end of your phone. The referral centers in your practice are all equipped and meant to be there to support you. Same with the universities. You can always call them and ask them questions. Antech, IDEX, your diagnostic companies all have people wanting to help you. So, you are not alone. And again, as a newer graduate, now is the time to be admitting that you don't know everything, looking into those resources. And I always think there's nothing wrong with telling clients hey, I'm going to go look for more information, because I really feel like for any case, no matter what's going on, even if it's urgent, there are resources to support you.
Yeah, absolutely. That honestly leads into my next piece of advice. So that's great, which is
Perfect.
to stay connected with your colleagues and friends from vet school. They have been an incredible support group for me over the last 20 years. My 20-year reunion is coming up. I am so excited to see people that I haven't seen in a long time. But do the things like join the Facebook group, stay there, because those people, you went through a lot together, and those shared experiences, I think, really make some long lasting bonds. And so, I love the fact that I have this kind of small group of 4 friends from vet school, and we still try to get together and FaceTime each other once a month, just to catch up and see each other. And so I think staying connected with colleagues, friends, keep that support group, because there are definitely challenges unique to this profession that other people are not going to understand unless they're living it.
I think that is one of my favorite ones, and it actually, for us not planning this out, Alyssa, it segues very nicely to my next one. So I'm going to lump that all in, which is don't burn bridges, because it is a small profession. Like you said, those friendships that you might have made as a first year student, writing notes back and forth to the person sitting next to you, they might be a specialist now that you can call and ask for advice. And obviously, that pales in comparison to the importance of the friendship. But it is funny how many times you wind up relying on, like you said, those classmates that you were like a young 22-year-old with. But translating that into practice, it is a small profession. The assistants, the technicians, the other vets that you work with, it's a small community. And just building the foundations of those relationships really can open up doors for you in the future. So I would say, next piece of advice, don't burn bridges. Don't undervalue the importance of building strong relationships and friendships, both professionally and personally, and how much that can make your career more rewarding. And again, open up doors, potentially later in the road.
Absolutely. And there's nothing wrong with leaving a place that, isn't a good fit for you. And you can absolutely do that without blowing it up, so,
Right.
so a good thing, absolutely a good thing to remember. One piece of advice I would have, it's kind of surprised me when I first started practicing, that you would need to do this, but kind of figure out where your ethical line is and then stick to that. Because, and, there's some of this kind of professionally where things might be expected at your practice that you're not comfortable with, whether that be cosmetic procedures like, tail docking or ear crops, which aren't as common anymore. And certainly for our global audience, we know that these procedures are banned, in a lot of places. But even clients, like I remember, somebody is going to ask you at some point to do something that you're not comfortable with, and you have to stick up with yourself. I know I've had clients over the years ask me to forge health certificates and, write prescriptions without having seen their animal, things like that. And so, it can be a slippery slope when something seems kind of harmless at first. So my advice is, draw that line in the sand and stick to it, because you have to live with yourself. You're responsible for your own license. You have to sleep at night. So
I like that. I like not only the ethical side, but like you said, boundaries with the clients. I mean, drawing that line in the sand and really not letting those clients walk all over you, I think is something that if you establish it earlier on in your practice can save you a world of hurt later on. Um, all right. Number 3 for me is a much more tangible one, and that is to double check and label every drug dose. Fortunately, I can't say that I've learned it the hard way, but I feel like it's something that one of my mentors in vet school emphasized, and hopefully it's being emphasized everywhere, but just how far double checking can go and labeling can go. I can think of many times where I pulled up like a drug dose because I'm going to pre-medicate someone for surgery, and it would be so easy to just stick it in my pocket without labeling it because, like, I know what it is and I'm going to be the one giving it. But again, just I feel like when we're messing with drugs and really trying to avoid mistakes, that's kind of one tangible piece of advice I would offer, because clinics get busy and you get scattered and you just never know.
I agree. And I'm a huge proponent for having somebody else check, not just double check
Hmm.
it yourself. I hand people, I hand my licensed nurses, my licensed technicians, my drug calculations all the time, and say, double check this for me. So, relying, this is a little extra one we'll slide in there is
Yeah,
that your staff is a fantastic, wonderful resource that you have around you as well. And so after years and years of doing things, you kind of know about how much Mirapatent should that cat be getting. So having them double check that for you, I think is a great thing. No, that's a wonderful piece of advice.
yeah, I think especially early on where you may not
Hmm.
recognize that you're off by like a decimal point,
Hmm.
on your
Yep.
drugs. So yeah, don't be afraid to ask for that
Yep.
surveillance.
Um, so let's see. Number 4 for me is, another thing that I feel like, and hopefully they're teaching it a little bit better now, but when I was in school, I didn't quite grasp the importance of the fact that effectively communicating with clients can be as important as your clinical knowledge, and maybe I would say even more important, because you know, we have to be able to show our clients the value of what we want to do and what we're doing in order to get them to do it, because they're the ones that are paying for it. They're the ones that are going to have to, give all these medications that we're sending home with them. And so being able to effectively communicate that with a client is huge. And so if you need to practice that, or need to practice phrasing, or need to get that friend from vet school on the phone and say, run through this with me, run through this scenario, I'll be me and you be the client, and argue with me, those things are valuable.
As I say, don't they say role playing is like one of the
Mhm.
best ways to learn things? But no, that's a good one. And as we were making this list, I was like trying to figure out a way to incorporate client advice into this. And I feel like so much of dealing with clients and dealing with people really is time and experience. So as you're a new grad, like you really are building that, and it really just takes a lot of time dealing with different types of clients, different types of
Mhm.
communication styles, different types of people. I think that's one of the most valuable skills that vets either have or wind up developing is those communication skills, because they have to. So I'm right there with you where I think it's just as important, if not more so, than your clinical knowledge. So I think in going back to the resources thing, there are so many resources out there as well to help with client communication about medical things so that you can spend more time, maybe listening to the client in the exam room. I think listening goes maybe that would be my piece of advice around clients. Just listening goes such a long way rather than trying to spew all of the information we want to give them, but really listening. So I think that's a good one, Alyssa. Let's see, number 4. This kind of goes back to my first one, but number 4 I have for lower the expectations for yourself. I think I would get and still do get sometimes frustrated when I feel like I don't know the answer to something, or I can't come up with a diagnosis, or, I need to consult an internist to help me with my differential list. Like, I do get frustrated with myself. I think I've been doing this for 12 years. I should know everything. And, of course, that was even worse when you're a new grad and you really don't know a lot, but remind yourself that you went to school for 4 years to learn everything there possibly is to learn about every species, and that maybe it's okay that you don't know everything when you're done. And even sometimes I get frustrated about that comparison to human doctors because sure, their med school's 4 years, but then, all of them are doing an internship and a residency, and they have mentorship in the hospital setting, even as practicing doctors, where so often we're alone. So that would be my advice: is lower expectations for yourself. You don't need to know everything. You're not meant to. You are meant to be in a position where you know where to find information if you need it, to act as that liaison to the information between the client and whatever resource their pet needs. So just kind of not carrying the weight of the world when it comes to that sort of thing.
And I think just kind of piggybacking on that too, you're going to make mistakes. I've made lots of mistakes. And so be able to give yourself a little grace and forgive yourself. I think along with that too, so that that, when things happen, this is an opportunity to do it differently next time, or if you see something go badly, then that is always a learning experience. And hopefully you can prevent that situation from ever happening again, you know? So, because we all make mistakes.
I know. I think that's good to tack on because I think, um, yeah, I know we've talked about this before in the podcast, but humans are the ones who are practicing medicine. So therefore there will be errors. There will be things that are our fault. Mistakes will happen. Bad outcomes will happen. And, that's just part of the fact that these are humans doing these jobs. So trying not to get too stressed about that, whether you're a new grad or not.
Yeah. Yeah. You can still get stressed about that even after practicing 20 years. So,
Absolutely.
all right, brings me to my last one. My last one is save your thank you cards. So over all of the years, I have saved every single card or piece of mail that I have gotten from clients, and I keep them in my desk, and I will pull them out when I'm having a bad day, because it's really easy to let one negative interaction color your whole day or your whole week, and to kind of put out of your mind all of the good that you've done and all of the people that appreciate you. But if you have that little stash of cards, you can bring that out and you can help remind yourself of all the pets that you've helped and all the clients that you've helped and the good that you've done. Because I know everybody that's in this profession is in it because they want, they truly do, are very passionate about care, for our four-legged companions. And so save those cards.
That's good advice, especially, anytime you're having imposter syndrome. I feel like if there's a drawer you can open that has tangible people who you have actually helped, and you can remind yourself of that helps decrease that imposter syndrome, I think. So it's a good one. My fifth one is also a tangible one. That is, do your notes as you go. Which, Alyssa, I know you said you'd wish you'd made that a habit earlier in your career. I wish I'd made it a habit earlier in my career as well. But I remember, especially as a new grad, when things take you a little bit longer and you're getting flustered and the day is chaotic, like it's so easy to try to do 20 patients worth of notes at the end of the day and then be stuck there all night. But I like to remind myself, like, people can wait 3 minutes. Like, that's usually how long it takes to do most notes. Unless they've already been waiting for an extended period of time, they can wait 3 minutes. You can have a staff member distract them for 3 minutes. But I feel like my notes are better when I do them right away. And then I can have a better work-life balance, which, of course, I think is one of the best things you can ask for in a career.
I agree. I think that's a good one to end on. And like you said, I do wish that I had internalized that much, much earlier in my career. So get in those good habits now, and you'll set yourself up for success for years and years to come.
Yes, good advice, Alyssa. Well, I think that brings us to our win of the week. Any big wins this week for you?
I have a huge, huge win to share. Actually, my win starts with a little bit of sad news. But so, if people are familiar with the show, have listened before, have listened to the Clinicians Brief podcast, you know that I had a Dog Day Bordeaux, Luna. She was my love. She passed away. And so it was a little bit unexpected. And I was very, very sad, obviously, because she was my heart dog. Um, but I really couldn't last too long without a dog in this house. And so shortly after she passed away, I actually got in contact with a Dog Day Bordeaux rescue. And my family has brought into our home a 5-year-old female Dog Day Bordeaux named Emmy, who is settling in now. And, I think we're going to be really good. I know, Beth, you've also adopted a fully grown dog, and sometimes that has its challenges. This has had a few challenges as well, but overall, I
Yes.
think we're going to be okay. And then I'm gonna start looking for a puppy too, so that I can kind of overlap them, because this one's
Oh my
5 years old.
gosh.
Well, yeah, because I don't want to go through that again. When Luna
Sure.
passed away, we were dogless, and that I can't have that situation again. So
I completely understand. Yes, first of all, may Luna rest in peace. I know she
yeah,
was just the best girl.
she was.
But how lucky that Emmy gets to fill her role in your house. She's a lucky
Yeah.
girl. And I may have said this on here before because I believe it so strongly, but I feel like you are in the minority if you don't regret your new dog for at least like 3 months. I just think there are so many growing pains with adopting, buying, whatever, however you acquire your new pet. It's just, yeah, it's a change for everybody. So I hope she continues to settle in. And I'm with you. Honestly, the whole reason I have a second dog is also so that I don't, have some sort of emotional break if I'm down to one dog. So anyway, Alyssa, we will look forward to hearing how Emmy does. And to our listeners, thank you for listening in, and we will catch you all next episode. Thank you for listening to today's episode of Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a VetMedics production, produced by Alexis, Ussery, and co-hosted by Dr. Alyssa Watson and Dr. Beth Molleson.